I want to give you guys a comprehensive overview of what you should expect and how you should feel about the hair transplant from the beginning to the end. So this is how it goes. First of all, you have to do a lot of research to find the right hair transplant surgeon. If you know somebody who had a perfect hairline and you really like that hairline and you know it's transplanted, that's a good way to start your research. If you don't, online research, find a lot of before and after videos or photos and see what's more appropriate for you, what you feel good about it. And then when you go talk to a physician, to a hair transplant surgeon, don't even limit yourself to one doctor. Go, shop around. This is a big deal. This is a permanent result on your face for the rest of your life. At the consultation, this is what you should expect. A doctor should get a good history from you, family history, medical history, your personal hair loss history, medication that you're taking, and they should do a microscopic evaluation. I think that should be a part of any hair loss evaluation. And then after that, you can sit together with the doctor and they can come up with a master plan. A master plan is something that you need now, and it's good for you for the rest of your life. It includes medical treatment, it includes surgical treatment, even cosmetic changes you have to do. So then you design a hairline, the doctor design a hairline for you. You make sure you feel comfortable about the hairline. If you feel your hairline is not quite what you had in mind, ask the doctor to explain to you why they feel that's the hairline for you. Sometimes they can convince you. Sometimes people come to my office, they expect a 16-year-old hairline, which is going to be ridiculous when they become 60 years of age, because this hair transplanted hairline is permanent, it doesn't go anywhere. So you have to be very comfortable with understanding the whole process, the location of hairline and the shape of it, and it should be appropriate for your face, and it should not be cookie cutter. It should not be just one hairline for all. Every person has an individual hairline, and the doctor should spend time to see it from different angles to make sure it's perfect for you. After that, you can talk about the number of grafts and how the procedure is. Make sure you understand the process, the whole system of hair transplant and afterwards, and all multiple interactions that you may have with the doctor and the team. You have to be aware of them. Then you can, book your procedure if you're comfortable with the whole process. And then you want to make sure that before procedure, you shouldn't take any medication like aspirin, ibuprofen, and stuff like that. Stop everything that you don't have to be on for 2 weeks before procedure. The day of procedure, you should expect to get some sort of sedation. You should be comfortable. You should be relaxed. It's a good day. People usually enjoy it. So when they come, they feel some, lightheadedness because of the medication we give them. You may feel some pinching in front and back of the head. That's the local anesthesia. That makes your whole scalp numb. Then the doctor will work on your head, making the size, designing the hairline. You should not feel any of this. You should not see any of these. Most of our patients are having the eye covers, listening to your favorite music. They usually take a few naps in the morning. So then they change your position because they have to start extracting and placing. As we do it in our office, we do extraction and placement at the same time to preserve the quality of grafts. So every hair comes out and goes right back in, so we don't lose any hair in the process. It's called simultaneous extraction and placement, SEP. So in the whole time, you may not even have a recollection of the whole thing because you're kind of sedated, you're very comfortable, you're going to face down and face to the side. And then toward the half of the day, you serve lunch. You should expect a delicious, fancy lunch, and you enjoy it, and then after that the work resumes. And then another set of extraction and placement, because we don't want to extract all the grafts and have them sit out of the body while you're having lunch. What's the point? We want the grafts to come out and go back in fresh, so every single hair can take and be 100% viable. So a few more hours in the afternoon. You might be sitting for most of it, watching TV maybe or something if you want to. And then when you leave, most of the time you have a bandage around the scalp that supports the donor area. You may have a hat on top of it. The night after procedure, you may or may not have some minimal pain. If anything, we give patients Tylenol. That's usually good enough. You have a sleeping pill to make you sleep better, so you'll move around, touch the transplanted area. We bring patients the day after procedure. So what you should expect this first day after procedure is that we remove the bandage, we wash it for you, we give you a special shampoo and a sponge. So we wash it in a certain way that you need to follow for the next 4 days after procedure. It's very straightforward, not a big deal. You don't have to even memorize anything now, but you will get to learn it, and we have videos about it. So after the first hair wash, you don't need a bandage anymore. So you go out without a bandage, you can leave a hat on in most cases, and you wash it at home for the first 4 days after procedure, twice a day, morning and evening. And that helps the scabs to be gone. You may have some dryness here, some little geometric look for the first few days, some swelling on the forehead, eyes might get puffy occasionally. But usually after day 4 or 5, the swelling is gone. The scab should be gone after day 5 if you wash it properly. In fact, after day 5 is when you can go and take normal shower. You can go in the shower, wash it normally with no problem. The scab should be gone, and you should look pretty decent actually. The first week or 2 up to week 3, you look like you have a buzz cut, but everything is there. You don't lose any hair, the scabs are gone, you look perfect. But don't count on it yet, because you may lose those hair shafts on the transplanted area. After 1 month, most people lose the hair shafts and end up where they were before the procedure. So you may just look like how you were before, no change at all. A little bit disappointing, but you know that it will grow back. After 2 or 3 months, you start seeing new hair growing back, and they become thicker and fuller over time. And at probably 6 to 8 months, you have enough few centimeters of hair so you can start combing and styling it. At probably 10 to 12 months, you see full result. And we usually bring patients back at 8 months, which is a good time to see most of the results, so we can discuss the progress, and if they need any help in the future, we can talk about it at that point.